welcome to my channel. Today I'm going to be going through what pain reprocessing therapy is, as well as the 5 components of pain reprocessing therapy. So first, what is pain reprocessing therapy? Pain reprocessing therapy is a scientifically backed method for curing chronic pain. Not just managing symptoms, but curing chronic pain. It has been scientifically proven through recent clinical trials called the Boulder Back Pain Study. In this study, 50 of the participants were assigned to pain reprocessing therapy, 50 participants were assigned to a placebo, and 50 continued the treatment that they were doing previously. So if they went to the chiropractor, they continued that. If they were seeing a physical therapist, they also continued that. And these participants had to have experienced symptoms of chronic pain for half of the days of the past 6 months. So they were experiencing symptoms pretty regularly and for a longer period of time. And a lot of these participants had been experiencing symptoms for years, if not decades, and had all sorts of conditions of the spine, such as degenerative discs, bulging discs, herniated discs, and then after 1 month of treatment, 98% of the participants that were assigned to pain reprocessing therapy had a significant decrease in symptoms, and 66% of the participants were nearly pain-free or completely pain-free after 1 month. And then a year later, researchers followed up with the participants and found that the results still held. Those who were out of pain after 1 month continued to be out of pain after a year. And if you're wondering what kind of pain can be treated with pain reprocessing therapy, it's what is known as neuroplastic pain and is a lot of chronic pain conditions, but I will link a video that I have gone through the signs of neuroplastic pain, so if you're wondering if pain reprocessing therapy would work for you, that's a great video to check out. And now I'll go on to the 5 components of pain reprocessing therapy. First component of pain reprocessing therapy is education about the neuroscience of pain. This is something that makes pain reprocessing therapy different than a lot of other modalities of treatment. Research has shown that other forms of psychotherapy, such as cognitive behavioral therapy, aren't effective in treating chronic pain, but pain reprocessing therapy is. And one of the distinct differences is that piece of education about pain science, which makes sense because a big goal of pain reprocessing therapy is to rewire the neural networks associated with pain. A lot of times, chronic pain persists because there's a misinterpretation of the brain, meaning that there's safe sensations in the body, but the brain misinterprets as dangerous and creates pain, the danger signal from the body. But then by understanding how chronic pain works and how this misinterpretation happens, that is the start of the logical brain understanding what is happening, and then that can trickle down to the more unconscious parts of the brain. The second component of pain reprocessing therapy is attending to sensations through a lens of safety. The goal of this is to reduce overall fear surrounding the pain, because when the brain stays in a fight or flight state, a sympathetic nervous system state, it is in a state of hypervigilance where the brain is more likely to misinterpret safe signals from the body as dangerous. I kind of like to think of it this way. Say you're really afraid of the dark and you're walking home at night, and because you're afraid of the dark, your brain is on high alert. So then when you hear any noise when you're walking, you will be hyper vigilant to those noises and perceive them as dangerous. You'll perceive it as someone following you, or if you're walking through a wooded area, maybe you think it's a bear or a dog. But if you take the same situation with someone who's not afraid of the dark, doesn't have that same fear, they won't perceive those sounds as dangerous, but will be able to understand what it really is. Maybe it's your neighbor walking down the street or a squirrel. So when the brain is in that high alert state, is more likely to perceive safe signals as dangerous and create pain. A great way to help the brain relearn that these signals are safe is through somatic tracking, which I will link a video that I've created, a guide to somatic tracking, in the description, and you can try that on your own to begin to rewire these pathways. The third component of pain reprocessing therapy is gathering personal evidence, which can be done in the form of lists. That's what I did when I first started, was I would make a list of all the evidence that I had for neuroplastic pain. So that can begin with the signs of neuroplastic pain from the other video that I mentioned. It can begin with those signs that apply to your specific situation, and then just being a detective and finding times when the pain doesn't act in a way that you think it would. Maybe you have back pain when you sit, but you were watching a movie and you didn't notice the pain. Or you have neck pain and you normally have pain when you turn your head, but you notice times that you don't notice that pain. Just looking for those times when you would have expected yourself to have pain, but you don't. Just those little times. And the fourth component of pain reprocessing therapy is addressing other emotional threats. And what I mean by that is just shifting your focus to the emotional aspects. A lot of the causes of PE is from either suppressed emotions or emotions that keep us in a state of hypervigilance. And we want to address these emotional states. This can be through journaling. You can just pick a topic and just journal on it. I will also be posting a video of journal prompts and a blog post that can help you get started there. Or another way to address the emotions is through yoga. That's something that was pretty pivotal in my recovery, and I think that if it resonates with you, yoga is a great way to get in touch with your emotions, release emotions. It's just a great tool that I found is helpful, and I have yoga videos in this channel as well. And for some, that might mean seeing a therapist or seeing a coach and talking through things. Sometimes it's great just to know that someone else is there with you, that you aren't doing this alone, that you have support. Or sometimes talking is just a better way of letting things out. And the fifth and final component of pain reprocessing therapy is gravitating towards positive sensations. So this can be done in a lot of different ways. A few ways that I've found are useful for me is taking a pause throughout the day and paying attention to the breath. Just the pleasant sensation of the breath coming in and out. Or another tip is being present anytime that you are in contact with water. So that could mean every time you wash your hands, you're mindful and present in that moment, or when you're taking a shower, you're feeling the warm water and just enjoying the moment. And then another important part of focusing on positive sensations is also focusing on positive emotions. I've already spoken about how important it is to reshift our focus on the emotional aspects. And it's also important to focus on the positive emotions, noticing times when you're feeling positive, feeling joyful, feeling content, and then also cultivating positive emotions. That can be done through meditations, through keeping a gratitude journal, anything that helps you get into a state of positive emotions, but also not feeling bad about the times when you have negative emotions, just finding that balance. That is all of the components of pain reprocessing therapy. Thanks so much for watching, and if you enjoyed this video or found it helpful, please like or subscribe so that other people will be able to see this content, and share it with anyone you know who has any chronic pain and would benefit from this information. I know that I would have been so grateful if I had known some of these things earlier. It would have saved a lot of time and pain. And I hope that you have a beautiful rest of your day. See you soon.